Good evening. This is Arthur Gillespie, and welcome to Balance Orlando. We are doing session 3 of the 10 series Rolfing session, and we have Devo, who is our client and will be with us for the entirety of our sessions. And like we always do, we want to check in with Devo and see how she felt after our session several weeks ago. So I give Debo the floor.
So that session focused on the feet and the legs, and I was having this problem with my left foot that we think is the classic symptoms of plantar fasciitis. And I've been doing the things that you recommended, and it's not 100% better, but it's a lot better than it was.
So let me stop you here. So the pain that you're describing is right on the heel
Yes.
of the bottom of the foot.
Yeah.
And the exercises I gave you were the ankle circles to give you more mobility,
Right.
as well as strength in your foot,
Yep.
in your feet.
And,
okay.
And to elevate my feet, to try to make sure I do that at least once a day, to elevate my feet for about 10-15 minutes, and just to let all the stuff drain out, and to use the tennis ball to kind of give a massage down here, which that helps a lot.
Okay. And we do that because the bottom of the foot is the beginning point of the connective tissue, which goes, I apologize, the double, from the Achilles tendon to the calf muscles to the hamstrings to the gluteal muscles and to the lower back. So each day, Debo has been waking up, stretching, bending her knees, and if she feels like, ooh, I'm really tight today, she's going to get on that tennis ball and she's going to work on her inside arch, her outside arch, the ball of her foot, the transverse arch, and she'll also rub the inside of the heel. And this governs how tight the inside of the lower leg is, as well as the outside heel, which is kind of hard to see.
Yeah, I can't fix that one.
Right here. Okay, so thank you for explaining the exercises you've been doing.
There's something else I just wanted to mention too, is one of the great things is that the work that you did also brought a great deal of awareness to my feet. And so when I got into my car, I have a stick shift, and it was the very next morning after working out, or after the session with you, I got into my car and I was like, oh, this is part of my problem. My seat is not adjusted the best way, and I'm doing this stuff with my leg every time I'm pushing the clutch, which is really not good. So I readjusted the seat, where I've been driving the car like that all this time and had no idea, but just all that extra awareness and attention to my feet, it was like, oh, this is what's wrong. So that's helped a lot as well.
All right, thank you. Today, we're going to work on the upper body. So typically the odd sessions, we work 1, 3, 5, 7, 9. We work on the upper body. The even series 2, 4, 6, 8, we work on the bottom of our feet and lower legs. And then 10 is where we work both upper and lower body. So since today is session 3, we're going to be working on your upper body, and we're going to be focused on any rotations in your body. So before we get up from the table, I'm going to be looking at if there's a rotation clockwise or counterclockwise in your upper torso. And I will tell that because I'll see if one shoulder is more internally or medially rotated than the other. And I'm also going to look at your umbilicus, your belly button. And if I see that it's shifted a little bit to the right or to the left, then that means we also have a rotation in the pelvis. And this is something that we will address today. So right now, we're going to get off the table so I can see how you walk. And let's walk to the door. So I'm looking at a couple things. I'm looking at how much the shoulders swing, and while Debo's walking to the door, I noticed that the left arm swings a little bit more inside than the right. And I'm going to have you walk one more time. And now I'm looking at Deborah's lumbar region, and I'm looking to see if it moves like a pendulum, because when it moves like a pendulum, then the hips are really working from side to side, and the buttocks goes up and down, and then we have a very good motion. So I'm going to have you take 3 steps forward, and then when you do that, I want you to place your feet hip width apart. And you're going to look forward and with your hands down, and I'm going to make a decision as to what side I'm going to work first. And so I'm determining which shoulder is lower. And in this case, from the back, it is the right shoulder. And I'm looking at the spacing between the armpit and the hip on the right side versus the left side. And I've determined that I want to work on the right side last, since that distance between the armpit and hip is shorter than the left side. So Debo is going to come back on the table. She's going to lay on her right side so I can work on her left side first. Okay, so Debo is on her right side and we'll be working her left side first. Some of the major muscles we'll be working this evening are the levator scapula, which attaches from the occiput to the upper scapula. We're also going to be working with the infraspinatus and the rhomboids. And we're going to also be working on the quadratus lumborum, which is just lateral to the erector spinae. And I apologize for making you ticklish.
No, I am ticklish.
Oh, okay, you are.
Ticklish.
Okay, thank you. So one thing I'd like to do in the beginning is to give you a lot of length in from your last rib to your hip. So we're going to place our left hand on our head and we're going to slowly extend to the door. And on my cue, we're going to start that process of giving you length in your left side. So on a count of 3, 1, 2, 3, extend. Good. Come on back. And again. Good. A couple more times. And it's almost like I'm just hooking right underneath Debo's hip bone. Good. How is the pressure, Debo?
That's fine.
Okay. 2 more times. Excellent. And last time. Good. And you can place your hand anywhere you want to. Now I'm thinking of an imaginary line from Debo's hip to her armpit. And my goal is to give length between the rib, her last rib, the 12th rib, and her hip. This is also a good way to see if the fascia is tighter on the front side of the body or the back side. And at any moment, if you feel that I'm applying too little pressure or too much pressure, please let me know, Debo. I was just recently working with a client, and they said they wrote down what surgeries and what bone breaks they had. And when I was working session 3 and I went over one spot, she my client kind of yelped and then told me, yes, this is where I had the prolapse. I had the herniated disc. So Fear not if you can't remember every single surgery or every single break of a bone or a sprained ankle. We'll eventually get to it. And what I like about Devil's fascia is that it's very easy to access. The skin is soft, there's good tone. Good. Now what I like to do is to, and this was the case in Devil's case over the last couple of sessions, is there's a little bit of tightness right here in the levator scapula, in the distal attachment. And so what I'd like to do is to give length to that muscle. So I first kind of place my outer knuckles right on the edge of Devil's occiput.
I think I felt that tightness when I was doing the moving my arm from at the beginning of this session. I think I felt some of that.
Okay. So Devil is just saying that she felt a little tightness in the beginning of the session when she was moving her arm. Now I'm working primarily on the belly of the muscle of the levator scapula. And all the while I'm just gently just taking her shoulder with my left hand and just slowly taking it away from her neck and towards her feet. Okay, so now after giving the appropriate length in Devil's cervical vertebrae as well as in the quadratus lumborum from that 12th rib to the hip, now we're going to work the infraspinatus, which is the muscle right on top of the scapula. So you're going to place your left hand by your chest and we're going to gently extend in this direction. So give me 1 second. And we're going to do this about 7 or 8 times. And I want you to extend towards the heater. So while Devil's extending and when she comes back, I'm not moving my fist at all. And what's happening is it just naturally wants to go down. It wants to go from the most lateral part of her scapula to the most medial. And now we're going to change the angle, and I'm going to ask you to reach towards, yes, the spine in the corner of the room. Excellent. Come on back. Good. 2 more times. Good. And now we're going to go 3 times right in front of you. Good. 1, 2, 3, and relax. So the goal here is to loosen up the connective tissue. Actually, the muscle, the infraspinatus muscle right on top of the scapula. And when that happens, as well as the work done with the levator scapula, it'll start to take that shoulder down, giving you long muscles, which will give you softer attachments into both the occiput and the upper part of your cervical vertebrae. So now we're going to work with the muscle just medial to the infraspinatus. That is called the rhomboid. And the main function of the rhomboid is to take your scapula and retract the scapula so they come in. And the best way to do that is to do a jumping jack from, let's say, 0 degrees, which is right by your hip, to about 70 degrees. So I'm going to start right by the levator scapula, And I'm just going to gently assist Debo.
Feels so good.
And I'm almost like working right underneath the scapula. At the same time, I'm making sure that Debo does not use too much her upper trapezius muscles. Good. And now Debo's going to lift up 3 times.
All the way, or just...
To keep on going right there and come back. When I start to feel that you start to engage your upper trapezius muscles, and again, I'll ask you to stop. Good. Come on back down. And last time. Excellent. And come on back. Now I'd like to recheck the work that's been done. I'm going to work on the occiput again and see if there's any softness or if that part of the attachment has actually become softer of the levator scapula. Working the belly of the muscle of the levator scapula. Excellent. Now I'm going to work the rotator cuff muscles. So Devil's going to put her hand back on her head. And while she extends her hand towards the door, I'm going to place my ulna right by her armpit, her axilla, and start to go down. So let me just get a little bit more water. So we're going to do this about 4 times, okay, Devil? Now I want you to go very slow. And on the count of 3, 1, 2, 3, extend towards the door. Good. Come on back. We'll do this 3 more times. Good. Come on back. 2 more times. Good. Thank you. And last time. Thank you. Now, I want you to place your hand anywhere you want to in front of you. And now I'm going to prepare doing work on the quadratus lumborum. You'll see during the sessions that I'll be doing the same movement, and I do that so that to see if the previous work I've done actually has made that area better. So you probably saw that with Rolf session 2, with the bottom of the feet. Any soreness here, Debo?
No.
Okay. My apologies.
It's okay. Put a disclaimer. Client extremely ticklish.
A disclaimer. Client extremely ticklish. Okay, I like that. Now, I'm going to be working both the proximal attachment, which is the attachment into the 12th rib, and then the quadratus lumborum slowly fans out like a triangle and attaches to the hip. So double, I'm going to have you place your hand by your head, and let's work on that proximal attachment. And whenever you're ready, I want you to slowly extend towards the door. And I want you to remember what this feels like over the next 2 times. Come on back. Here we go again. Good. And last time. Good. Now place your hand anywhere you want to. Now I'm going to go the opposite direction towards the hip. And when we do that, I want you to place both knees on top of one knee on top of the other. and I want you to extend your leg here.
Okay.
Okay, so now, double, we're going to work on your distal attachment of the levator scapula. So now I want you to extend your lower leg, please. Come on back 3 more times. Good. 2 more times. Excellent. Come on back. And last time. And relax. Double, can you tell me if it were tighter going up towards your head, towards your last rib, or towards your hip, or about the same pressure?
It felt more tightness when you were going away.
Towards the hip.
Towards the
More
hip, yes.
tightness towards the hip. I felt the same as well. Okay, so I'm going to have you continue to extend your knee, and this time I'm going to start actually right by the hip and go from outside to inside. And we'll do this 4 times. And here we go. And come on back. Let's just do one more time. Good. Come on back. So we have worked on the levator scapula. We've worked on the infraspinatus. We've worked on the rhomboid muscles. And now I'm going to go back to what we did initially, which was imagining this line from the greater trochanter of devil's hip to her axilla, to her armpit. And it's just a way to see if it's even easier to access the fascia from that imaginary line to her spine. I'm not sure if people know this, but I wanted to ask you if you broke any ribs or uh, bruised any ribs over the last couple of years or ever.
Well, ever like I was like 11 years old. I got hit by a bat in my stomach, and I lost. I mean, it was a complete accident in PE class. I lost a lot of air, and I might have bruised myself, but I never had anything broken in my rib area.
Okay. I'm going to have you to extend this way just 4 more times on my cue. 1, 2, and 3. I'm placing my hand right back to the rhomboid, and although this is not the primary function, come on back. I want to make sure it's very hydrated so that when Devil is walking, there's really good free movement in the left shoulder when it swings when she's walking. Good. And last time. Good. Come on back. And now Dubbo is ready to come off the table and walk and see how that shoulder is feeling. Okay, so now Dubbo is off the table and we're going to walk a couple of times to the door. And what I'm looking for is how well the left shoulder is swinging compared to when I first asked her to walk about 20 minutes ago. So Dubbo, let's walk to the door. And one more time. Okay, thank you. And have a seat. I want to briefly explain what I see or what I saw in Debo's structure while she was walking. The first thing I saw was not even in the shoulders, it was looking at, I like to call it the pendulum of the lumbar region, and it was moving more than it was about 20 minutes ago. And so the hips were abducting a lot easier. So I like that a lot. The second thing I saw was there's less of you carrying your shoulder in this fashion, and it seemed to be having more of a normal swing. What was your experience?
Um, it sometimes for those things it's hard to feel the difference in such a short walk, you know. So I didn't really notice a difference, but actually weirdly now sitting and looking at myself in the mirror, it looks like my right shoulder is higher than my left. So I see I feel like I see that difference.
Okay. All right. Thank you. Now we're going to work on the right side. So I'm going to have you to lay on your left side.
Okay.
Now we're working on Debo's right side, and this is the side where I found the distance between her axilla and hip to be shorter than on the left side. So, like we did last time, Debo's going to take her right hand, place it on her head, and she's going to extend to the door. And I'm going to position myself and kind of give a nice hook to the hip as she extends. So let's do this about 4 or 5 times. And here we go. 1, good, come on back. And 2, good. And 3, and okay. And Devil's going to extend her hand to the door, and that's a better stick.
So when I'm doing this stretch with my arm now, the shoulder part feels less tight.
And where in the shoulder are you referring to?
Kind of around this area and then just like inside.
Okay. So we're talking the posterior deltoid and also a little bit of the rotator cuff muscles.
Right. I believe it's probably a lot of the rotator cuff muscles. I did injure my left rotator cuff a lot of years ago while rock climbing, you know, indoor rock climbing.
Yes.
And I used my arm to pull me more than my legs.
Thank you for sharing that with us. And as you come back, I want to share that I felt that this side was a little bit tighter and a little bit harder for me to fully give you length
Mm-hmm.
in this area between your rib and your hip compared to the left side.
From like even though the shoulder feels looser, the hip definitely feels tighter. So.
Now we're going to take the hand, place it by the hip, and I'm going to work on the back of the occiput. And what I'm feeling is a little tightness, not so much. What is your experience,
Yeah,
Debo?
it's definitely, I feel it more on this side than I did on the other side.
You're feeling it more on your right side, this side,
Yes.
versus the left side. Just, okay, one more time. Thank you. Now I'm going to work on the belly of the muscle, or the levator scapula, and just gently take with my right hand, just gently taking that shoulder away, giving Debo really good length in the levator scapula. Good. Now, since we're already here on our side, I'd like Debra to place her hand by her head again. And now we're going to work on the rotator cuff muscles. So Debra, when you are ready, I'd like you to extend to the door as I move towards your hip. Good. Come on back. Already I'm feeling a tightness, a little bit more of a tightness compared to the left side. 2 more times, Debra. Mm-hmm. Debra, you are right-handed or left-handed?
Right-handed.
Right-handed, okay. Excellent. Actually, just one more time if you don't mind. 1, 2, and 3. And you just said, So
yeah,
tell me what.
Good.
Okay. Now I come back, revisiting the occiput on the right side. Feels a little bit softer.
Yeah. Using the same pressure?
Actually, less pressure, but it's going deeper into the connective tissue, into the fascia. Okay. So now we're going to place our hand here. I'm going to work with that imaginary line. And I want to thank Debra for taking a very nice, comfortable breath. I know that when you're first getting worked on, you're probably going to ask your Rolfing or structural integration practitioner what type of breath to use. And I really don't have a one type of breath I like my clients to use, but I want them to feel very comfortable. So the default breath is just a nice inhale through the nose and an exhale through the mouth. And again, I want to thank Debra for her very long breaths. And so what I'm feeling right now is that the connective tissue, the fascia from that middle line that separates the front and the back to the spine feels a little less hydrated than on the right side. It's taking me more work, more pressure, more depth to actually go down into the connective tissue all the way from the middle of that imaginary line to the spine. So now Debra is going to place her hand by her chest and she is going to extend. So she's going to do that as I work on her right infraspinatus muscle. And here we go. You're going to just extend. Very good. Come on back. Good. Now I want you to extend towards the towel heater, if you don't mind. Good. Do you feel a difference between when you're extending towards the towel heater versus right in front of you?
Yes.
And what are you experiencing? 2 more times to the towel heater.
It felt a little harder to straighten my arm out all the way, doing it to the towel heater versus doing it straight out.
Good.
And it feels like it might be a little more tender where you're working when I'm doing this.
Okay, let's come back and extend right in front of you. And 2 more times. Good. Now I'm going to work with Debra's rhomboid muscles. So I'm just going to place my hand right by the distal attachment of the levator scapula and slowly go down double spine. Devil, how's the pressure?
Feels great.
Okay.
It does feel like this side may be just tighter or something.
Okay.
I feel you more on this side than I did on the other side.
And I'm basically trying to, I like to call it, collect lint from the inside of your medial border of your scapula. Now you're going to raise your hand up 3 times. Good. And come back down. 2 more times. Good. Come on back down. And last time. Good. And come back down. Thank you.
Feels so good.
So we worked the rhomboids and infraspinatus muscles so that they can relax, be hydrated more, so that the shoulder can lengthen, come down more, so that we can get longer muscles from the head to the neck to the shoulder. Revisiting the occiput on Devil's right side, I find it even easier. Okay, so we are on our right side, and we have concluded with work on Devil's levator scapula, rhomboids, and infraspinatus muscles. Now we're going to focus our attentions on Devil's quadratus lumborum. So Devil is going to extend her hand towards the door, and while she's doing that right now, I'm going to work on the quadratus lumborum coming up into the rib. Good, and come on back. And again. And what I'm feeling is I'm not getting that nice hook like I was on the left side. It's like I have to put a little bit more pressure to get into the connective tissue of that muscle. Just good. Come on back. And last time. Good. Place your hand anywhere you want to. Now we're going to extend our leg. Mhm. And I'll be working on Debo's distal attachment of the quadratus lumborum. So I want you to extend 4 times. Good. Come on back. Good. And again. And already I'm feeling this right side even tighter than the left side. I have to apply a lot more pressure to go towards Debo's gluteus muscles. Good. Debo, how are we doing?
I can feel that it's tighter as well, but what you're doing feels really nice.
Okay, let's keep on extending. And now I'm working on Debo's distal attachments. He's going to come back of the quadratus lumborum. And 3 more times. Good. And again. Good. And last time. 1, 2, and 3. Extend. And come on back. And now the last thing we're going to do is work on that imaginary line again from the greater trochanter of the femur to the armpit or the axilla. So already it's starting to feel a lot softer, a little bit easier to go inside the connective tissue from that imaginary line to double spine. Now, double, since you're here, I want you to extend towards right in front of you. I'm going to rework the rhomboid muscles. Good. Come on back. 3 more times. Good. And last time. Thank you. Come on back. Now, when you're ready, slowly come off the table and we'll walk towards the door a couple of times so that we can look at how the right shoulder is looking and moving while walking. And so now Debo is in front of us and she's going to walk towards the door. And what I really appreciate in Debo's physical structure is, and we're going to walk again, is the movement of her spine as she's walking. And I really like your symmetry as well. So kudos to you. I like the natural movement of your shoulders as you walk. And let's just walk one last time. I'll be looking at the hips. And I like the movement of the lumbars moving like a pendulum as you walk. So now we're going to conclude in the next 5 minutes by doing some hip work, your favorite hip work. So when you're ready, slowly come on the table and we'll work on your left side first, which means you'll be on your right side. Okay, so we conclude session 3 with some hip work, and we just worked on Debo's quadratus lumborum muscles on both her right and left side. We're now working on her left side, and what I want to do is to very gently start on the tensor fascia lata and just slowly with my left ulna to just gently take that left hip and move it in the direction of her feet, giving her even more length in her lower back. So what Debo is going to do now is to pretend like I've glued her heels together, and like a clamshell, she's going to raise her left knee up and back down. And we'll do that 4 more times. Good. 3 more times. I'm not sure if you can see this, but Debo is laughing kind of silently. Good. And actually 2 more times. I apologize, Debo. I've been having some issues with counting during the session and last time. And what I have been experiencing is not so much tightness right on the hip, but as I go more medial or more posterior, to her tailbone, it gets progressively tighter. So right now I am moving Debo's left hip to see how easy it is to move. And it moves very well, but there are some trigger points, and those trigger points are in her gluteus maximus. So we're going to do some movement work, and one of the best ways for me to release some of those tight spots and trigger points is for Debo to take her knee into her chest, and then if she wants to, she can extend her leg at that point, come back, and then start all over again. So let's do this about 5 times, and here we go. Good, and extend your leg, and come on back. And again. I'm palpating a very tight spot. So my goal is find that tight spot, hold it while she moves, and my direction is towards her feet. Good. 2 more times. Would you say you're more ticklish or is this more painful? Or both?
I'd say it's less ticklish now.
Hmm.
I wouldn't say it's painful.
It's not painful. Okay.
It's tender, but
Okay. I come back. I feel a little bit more movement, but know that your gluteus maximus from your sits bone, which actually feels good, so a little bit higher up, you can definitely feel the tightness.
yep.
Okay. So I'm going to have you extend your leg just like this and come back down as I work on that area of tightness in your gluteus maximus. Thank you for your deep breathing. Double 2 more times. So Debo just said, oh, wow.
Because I could feel stuff moving.
You can feel stuff moving, which means that when she gets home, I'm going to send her an email about how to use the foam roller for her gluteal muscles. So there's this a little tight right here. So we're going to lift our knee up just 3 more times on my cue. 1, 2, and 3. Good. And come back down. And 2. Thank you. And last time. Good. Come on back down. Re-examining the space between the last rib and the hip. We gained about 3/4 of an inch, but still the hip needs to just slowly drop a little bit more. And we're going to raise our knee just 2 more times. 1 and 2. That's it. And come back down. So your homework, one of your mini homework exercises is to use a ball or foam roller and really work on your gluteal muscles, especially the upper gluteal muscles and right where my knuckles are, which
Yep, I could feel it.
are your outer gluteus maximus muscle. Okay, now let's have you on the other side.
Okay.
Now we're working on Debo's right hip, and I am now feeling how easy it is to move Debo's hip from an anterior tilt to a posterior tilt. And I can already feel those trigger points, and I will share them with you.
So
They start at her sits bones, and they progressively go up in the gluteus maximus all the way into her tensor fascia lata. So the first thing I'm going to do, there's some pretty good spacing actually. We could definitely see some more space between the last rib and the hip. I'm going to come place my ulna at the tensor fascia lata and gently take that right ulna and take the hips towards her feet.
Oh, that tickles.
It tickles, okay. So now I want you to gently raise your knee like a clamshell and come back down. And we're going to do that again. And as I do that and go towards the spine, it's getting progressively tighter. Good. Come on back down. And again. Did you do leg workout today at the gym at 6 a.m.?
No, Tuesday, Wednesday, Thursday.
Okay.
Last leg day was Wednesday. It's usually Tuesday upper body, Wednesday leg, and Thursday kind of an overall.
3 more times. So it's even tighter on the right
Oh
side
yeah, feel that.
than on the left side.
Ooh.
And what I'm gently doing is taking the gluteal muscles and taking them even further down towards her feet. 2 more times. Good. And last time. Thank you. Come on back down. Feeling the space again between the last rib and the hip. We've made about another 3/4 of an inch away from the ribs. Already, we've only worked on the upper gluteal ridge, but the lower part, although she's ticklish here, feels a little bit easier to get in the fascia. So we're going to take your right knee into your chest. Double. Good. And come back. You don't have to extend. It's okay. I can definitely feel the tightness. We're going to ask you to extend right now. Good. Come on back. And again. To our listening viewers, what does this feel like?
Um. Well, it is tender.
Mm-hmm.
I mean, it hurts a little bit, but it's low on the pain threshold. But that's usually a good sign when it goes from being ticklish to hurting a little bit. Because when I'm ticklish, it's like my muscles don't want you to get in there. You know, that ticklish response is trying to force you out.
Mm-hmm.
Where I can breathe through the tenderness a lot more easily.
Good. We're going to go 3 more times, and you don't have to extend your leg. We can just take the chin into the knee into your chest, not the chin into the chest. Good. 2 more times. So what I'm feeling is a little bit more tightness on the tensor fascia lata than the left side. Good. Come on back, and just last time. Here we go. Good. Come on back. And I'm going to have you to raise your knee just 4 times. Good. 1 and 2. Gently taking the hip towards her feet. 3. And last time. Good. Now I'm like able to sink my thumbs into Devil's gluteal muscles a lot easier and using less force or less pressure. There are some tender spots like right here. And when I say here, I'm talking about the tensor fascia lata and gluteus medius. Okay, but I'm happy at what I see. We will conclude our session with a sacral cradle, which means you're going to be on your back. I'm going to place my hand underneath the sheet, underneath your sacrum, and we'll be doing some deep breathing. So the last part of our session is to do a sacral cradle, and I'm going to ask Debo to gently raise her hips, and she's going to come down, and my hand is right at her sacrum. I'm going to ask you to come up one more time and back down. Good. So what I'd like you to do is make sure the width between your feet is the same as the width between your knees. And I want you to start your breath where my top hand is and slowly take a nice deep inhale through your nose and exhale through your mouth. And what I'm already feeling is when Debo is inhaling, the sacrum expands in my hand, and when she exhales, it contracts. And 2 more times. Okay. Do not raise your hips. I'm going to take my hand from your sacrum, and I'm going to have you to slowly come off the table. And I'm going to look at your structure from the front, the side, and the back. Okay, so the first thing I'm looking at is the stitching of Devil's shorts, which goes right down the middle, and it bisects the umbilicus, the belly button, the outer edge of the rectus abdominis is straight, it's not on an angle, so I'm happy. Then we progress to the sternum, to the chin, and that is straight, so I'm happy. The second thing I'm looking at is the fingers. The left fingers are slightly longer, I believe only because the right fingers are not extended as much as the left fingers. Now they are the same length. This is good, and I like how Devil's hands are to the side. They're not more internally rotated or externally rotated. Now I'm going to have you face the mirror, and I can easily see if there are any rotations. And what I like about Devil's structure is that the ear to the deltoid, the elbow, the hip, the knee, and the ankle are all in alignment. And this is excellent. I don't see any rotations in your upper torso. Now I'm going to look at your back. So you're going to face the door. Good. So one visual I like to look at is the outline of the spine and the crease of the shorts. So it's just one long continuation from the bottom of your hips to your spine. And I really like what I see. What I like the most is the symmetry. I like the space between your inside arm and your ribs. And the last thing I'm going to do is just gently palpate the shoulders. I'm seeing how easy it is for the infraspinatus muscles to move back. And this is more a reflection of the rhomboids than anything else. But is that painful,
Not at
Devil?
all.
And compared to the first session, it's even easier for me to take Devil's shoulders towards her spine. So I'm happy. I want to thank you for a
Thank
great
you.
session. Thank you for
very
your
much.
time. And we'll see you in several weeks for Rolf session 4.